Dr. Yorker, when you first heard of the case of Gypsy-Rose and Dee Blanchard, had you ever heard of a case like this?
Yes and no. The parts that I had heard of, I'd heard of so many cases where children had a feeding tube, where they had unnecessary surgeries, where they had been isolated, they'd been kept at home, they had been doctor shopping, they'd crossed state lines. What I had never heard of was a victim killing their perpetrator.
What is Munchausen's by proxy?
Well, I'll start with Munchausen syndrome. Munchausen syndrome is a condition where somebody makes themselves ill for the purposes of getting medical attention. An example is a case I was involved in. A nurse passed out at work. She was rushed down to the emergency room. They saw her blood sugar was dangerously low. They pumped her full of some sugar water and told her to eat before she came to work. A month later, she passed out at work. They rushed her down to the emergency room. Her blood sugar was so dangerously low that they removed her pancreas because they figured she must have a pancreatic tumor. They sent her pancreas off to the lab. It turned out to be perfectly normal. So a month later, when she passed out at work, that's when the doctors thought, oh, maybe the insulin causing this severe hypoglycemia wasn't coming from her pancreas. And sure enough, she confessed that she had been taking her patient's insulin and injecting it in herself to cause hypoglycemic shock. That is Munchausen syndrome. When it's Munchausen syndrome by proxy or Munchausen by proxy abuse, instead of making yourself sick, you make your child sick or a dependent in your care sick for the purposes of getting medical attention.
It is so difficult to imagine a parent, a mother, deliberately harming their own child. What is the motivation?
To get their own needs met. And it's similar, it's so hard to believe that a parent would hurt their own child through incest. But that parent believes that they love their child. They are just hurting them when they molest them or try to have sex with them. But they think they're loving their child. So for a mother who is making their child sick, they are getting their own needs met at the expense of the child. And unfortunately, we do see that with other types of child abuse.
So is it a serious mental illness?
No. The people who do this are perfectly conscious and aware and plan and premeditate what they do. So it would be like, do you call a psychopath somebody with a serious mental illness? Well, I mean, there are some people who try to get an insanity defense because they're a serial killer, but no, the courts do not consider the need to get your own needs met ahead of your child or your family members as a serious mental illness. It's a condition, just the way substance abuse is labeled a condition, but it is not a loss of contact with reality, and it is absolutely not a defense to harming somebody.
I know you've seen so many cases, but I think, for most people, it's quite sickening what you're describing.
I understand that. It is sickening.
What are the characteristics? I know you mentioned some of these earlier in past tense in terms of cases that you'd seen before Gypsies. What are the characteristics of Munchausen's by proxy?
The characteristics of a perpetrator are that they are often quite articulate and they fit into society fairly well, and they are liars. And if there's one trait that we see throughout cases, because some of the perpetrators are not as middle class or as sort of socially acceptable. Some are sort of a little off the rails, a bit of a drama queen or something like that. But they lie to people and they lie to doctors. And if they lie to doctors to cause unnecessary treatments, medications, procedures, feeding tubes, surgeries, then those lies are criminal.
How does a mother or any parent convince medical professionals that their child is, in this case, terminally ill, when in fact they're perfectly healthy?
Oh, it's so easy. Doctors are trained to rely on the history provided by the patient or provided by the patient's parent. Half of the diagnostic reasoning that doctors do to decide whether to give a medication, to decide whether to do surgery, to decide what treatments are appropriate, that decision making is based on what someone tells them they are feeling, or they are seeing, or they are experiencing. So when a mother says, my child has been vomiting and vomiting and they can't keep food down, and the child looks dehydrated and maybe emaciated or underweight, the doctor believes the mother that the child has been vomiting and vomiting. And maybe it turned out that the mother is actually not feeding the child.
Because why would any mother make that up?
Exactly. So we need a healthcare system that relies on what patients and what mothers and what parents tell them is going on, and to assume that it is truthful.
What are some of the extremes these parents, mothers will go to convince doctors?
Okay, I'll give you a case example that I had about 25 years ago. A little 18-month-old boy came into the hospital with 105 temperature. That's over 40 Celsius. And they drew his blood and they saw that there was E. coli in his blood system. And the doctor said, that's so rare. To get E. coli into your blood system, either you have a leaking gut and some of your gut contents is leaking into your bloodstream, or you have an immune deficiency like HIV or like some immune deficiency and you can't fight off the E. coli that's just normal in the environment, or somebody intentionally put it in there. And they're all three equally unlikely. So at that point, I helped a local children's hospital do the legal groundwork on putting hidden cameras into the pediatric hospital room. And the doctor said, before we go putting tubes and cutting open this kid's gut, let's just put him in the hidden camera pediatric hospital room and see if someone's deliberately putting E. coli into his bloodstream. So he was admitted into the hospital, and they had the video cameras rolling, and a security personnel was watching. Within a few hours of coming into the hospital, they saw the mother disconnecting the little boy's IV line that was running liquid it was running normal saline into his vein in his hand, and the mom disconnected it. She got a syringe that she had just been in the bathroom with a dirty diaper and had filled that syringe with a murky liquid, and she connected that syringe to her baby's IV, and she pushed in about 4 or 5 cc's of a murky liquid. So immediately the security guard said to the nurse, get in the hospital, get in the room, mom is tampering with the kid's IV. So they came in. At that moment, mom knew that she had been caught and she was going down the stairwell of the hospital, but security apprehended her. And she confessed. I did an evaluation of her and of the child and of the situation, and the mother said, yeah, she had only done it that once. And that was because she and the baby's father had had a fight, and he left, and she was afraid that he was going to leave her. And she thought, well, if the baby spikes the temperature, he'll come back. So I testified in her criminal trial. She was sentenced to 2 years in prison and then probation. And I testified in her termination of parental rights case, because she almost killed that child. And it was not the first and only time she had done that.
What to you was the most shocking part of Dee Blanchard's abuse? The most horrific thing she did in order to create this fake reality?
Well, there were many things that were shocking, many things that were alarming, many things that were just make you cringe as to what Gypsy endured. I think the feeding tube is one of the things that gives me the most alarm, because once a child has a tube that either goes through their nose and into their stomach, or directly surgically a tube that goes into their stomach, that parent can put in any kind of poisoning or medicine or toxin, and they can also starve the child.
Total control.
Total control.
Can you explain how, I think one of the most puzzling things for most people who don't understand the syndrome is how a parent can create the symptoms of these terrible illnesses in the child? How Gypsy could present drooling, vomiting, looking like she was having a seizure?
Well, it's a combination of things. They can get the child to present symptoms by over-medicating them. So the child looks drowsy, or you can induce seizures. You can induce vomiting by giving a child Ipecac, which is medicine made if a child accidentally discovers pills and ingests them, and it's like a poison control, get the kid to vomit. But if they're giving the child Ipecac to make them vomit so that they look like they've got some terrible stomach condition, then you can do it that way. Roy Meadows' original article talked about a mother who had her 4-year-old daughter evaluated and hospitalized many times for urinary tract infections. And they finally figured it out when they got a urine specimen that was loaded with red blood cells and bacteria. They typed the red blood cells in the urine, and it wasn't the little girl's blood type. It was the mother's blood type. And it turns out the mother had been putting her own menstrual blood into her daughter's urine specimens. So these perpetrators can be very creative in how they figure out. They search on the internet. One mother had looked at, her search terms had been poop in veins, pee in veins. She'd been Googling what would happen if you put poop in your child's veins. And this wasn't the mother that I just described. And then there are also just over-medicating, or even giving too many supplements to cause blood specimens to come out all abnormal.
So I suppose in Gypsy's case, there were things that were likely never tested, like my daughter has leukemia. I mean, that could have been cleared up with a simple blood test. And my daughter can't walk, which could have been cleared up by simply, I guess, removing her from her mother and getting her in a room, but they were always together and Dee was always controlling the situation.
Well, the other part is coaching, that children are coached to behave a certain way, or in Gypsy's case, certainly she had a very baby voice. She sort of spoke in a way that sounded convincing that she might have developmental delays. And as far as testing for leukemia, if the mother says, my child has leukemia, we transferred from another hospital, The doctors often just don't have the time to go back and look through reams and pages of medical records to find the original diagnosis. Again, doctors rely on mothers and parents to tell them the truth.
Because why would any mother make up that their child has leukemia?
Exactly.
So the things that she did have symptoms for were things that must have been induced, like the drooling and the teeth, and those are the things that she had procedures to treat. When you think about a doctor, a surgeon going through with a procedure on a child, I mean, regardless of what the mother says, it's the medical professional's job to verify those symptoms, isn't it?
It depends. It's the medical professional's job to verify symptoms and to verify what a parent tells them if things are confusing. But if things are just simply clear-cut, most of the funding systems for a doctor encounter with a patient do not account for all the time it would take to verify everything that the patient tells them.
So if you had to, I guess, in a nutshell, how is it so easy for these parents, the children, to slip through the cracks? Is it the timing? Is it the funding? Is it the manipulation?
It's all of those. It's because the healthcare system is based on the truthfulness of parents presenting their children. We just cannot be suspicious of every single patient that comes in needing treatment. We have to think quickly. We have to act fast. We also have to get good patient satisfaction surveys. And so there are some doctors who might be wondering, I'm not sure about this exact condition, or they might be concerned. Maybe the mother is exaggerating. We're not seeing the child look as sick as the mother says the child is. But they're reluctant to confront the mother because they rely on patient satisfaction surveys for employment. Sometimes hospitals rely on those for funding.
Hindsight is a wonderful thing, but from all reports now, Dee Blanchard was particularly manipulative and convincing.
Yes, she was particularly manipulative and convincing, and we see that with pretty much all of the perpetrators that we see, is that they come across as urgent. They come across as articulate and compelling and convincing. And most of all, they come across as though they really, really care for their child and they want what's best for their child. And they sort of play the doctors as like, oh, but you're the doctor that can figure this out. You're the doctor that we trust. We really need you to help us with this disorder.
The one thing Gypsy could control was she knew she could walk. And I put this to her. I'm really interested in your take on it because it's the one question that everyone asks her. You know, why in this situation doesn't the child, the abused, why didn't she get up and walk?
That is a great question. Why Gypsy didn't just get up and walk. She did occasionally, and there were times when they did testing. Right now, I am aware of 4 or 5 cases where children are being kept in wheelchairs who can walk. And a lot of people see those children walk, but they have varying reasons as to why they can't. They will either say, well, I have such a bad seizure disorder that it's unsafe. If I were to have a seizure and fall over, it's better for me to be in a wheelchair. Or they'll say, My legs are very weak. I have a muscle condition, and I need the wheelchair to help. There are lots and lots of people who are in wheelchairs who can walk. Look at the airplane. Every time you get on an airplane, people are walking from their seat to the wheelchair in the rampway. So there are so many conditions that might justify a wheelchair that are not complete paralysis.
I want to ask you about the very complex relationship created by this syndrome. Because to me, Gypsy seems so torn. She says she loves her mum. She misses her mum. She talked to me very happily about good memories. And yet she organised her murder. It's a very complex relationship created by this disorder, isn't it?
Well, it's a complex relationship between children and their parents. Not every parent is perfect, but we can't help but love our parents, even when we see them as flawed human beings, and even when we see them as toxic and lethal. We have a desperate need as human beings that continues even up until or beyond our parents' death, which is that we want our parents to be the best that they can be, and we want our parents to love us.
Have you ever seen a Munchausen's by proxy victim driven to murder?
Only Gypsy.
When you look at her case, and you've heard her many times since her release, how do you characterise what made her snap?
I believe it was her good fortune that her mother was self-medicating, and her mother was often sleeping or in a drug-induced state, and Gypsy was free to get on the internet. And I think that, in a way, saved her. It opened a door to a life that she could see outside of that little house.
Because she had access to the real world and everything she was missing out on.
Right, right. And I did want to say that not all victims end up even being upset with their perpetrator. We are seeing quite a few victims who begin to believe that they are really, really ill. They believe their mothers. And then they carry on and they become Munchausen themselves.
Well, that makes sense. If you're told something from such a young age for so long and you're having all the treatment.
Right. And if you've been deprived of social normal growth, and then you realize that actually maybe you are more functional than you were allowed to be, that it's a lot to catch up on, to get to grade level, to have to go back to school, to have a girlfriend, to have to fit in with the kids and not get bullied. And for some kids, it's just safer to stay sick.
What was remarkable to me was to hear Gypsy say that at the age of 24, when she walked into prison, was one of the happiest days of her life. Because she could have a job and she could have her own room and she could have freedom. I mean, most people just can't get their head around that mentality. She'd been so deprived. How do you see her, all of the things you've just described? I mean, she's had to catch up so quickly in front of the world's cameras. It's a huge challenge for anyone.
It is, and kudos to her for doing that. Again, like I said, we are seeing now adult survivors for whom that's too heavy a lift, and that they would rather stay in the wheelchair.
I found her so calm and cool and collected that it was almost a bit disturbing. As she described her mother's murder and hearing her mother scream, I mean, really graphic details, she almost could have been telling me, you know, what she was having for dinner. Is that a common, is there a detachment there? What sort of ongoing psychological issues would a victim like Gypsy have?
Well, that very much sounds like some dissociation, and that is common among survivors of any ongoing trauma, especially when they're very young. So children who experience sexual abuse, children who are beaten, children who have no control over things that hurt them by a person that they love and they depend on, they very often learn how to just detach from the feelings. It's a coping mechanism, it's a survival mechanism, it's a way to adapt to an untenable situation. We learn some of this from prisoners of war, and we learn how the psyche can survive and cope with absolutely horrendous physical and mental abuse and torture.
She's about to become a mother herself. What are the main challenges that you would see given her only experience and, her role model, her mother-daughter relationship was abusive and ultimately fatal?
Well, I have good news, which is that I'm working with quite a few adult survivors now who are wonderful mothers.
That is good news.
I think that Gypsy recognizes that that she does not want to be the way her mother was. I think she'll work really hard to be a nurturing and caring and authentic mother. And, it is just a relief to see how possible that can be for survivors of such extreme abuse.
So you would have confidence that she can have never a normal, but you would have confidence that she could have a relatively normal, happy life and family life?
Well, I hope so. And luckily, we are seeing the resilience of survivors. At the same time, when we do see some mothers who perpetrate this, some of those mothers had that done to themselves. The difference is if they got no therapy, no insight, and completely bought what they were told about their own illness, and if they never really recovered so that they could get a healthier view of themselves, then there probably is a bit of a risk that they may not be the best parents when they become parents.
With all of your incredible insights into this syndrome and how this has unfolded, do you see Gypsy as a victim or a murderer?
I see Gypsy as a victim. I also see Gypsy as a survivor.